The meeting is being live streamed.
Yes, it's now complete.
Yes, I'm on YouTube and I can confirm that you're being live streamed now.
Okay, we're starting. Are we good to go?
Yes.
Hi, everybody. It's 4 o'clock today on 26th of October, and we're going to be discussing a very important topic. So I welcome all of you, those who are watching us live on YouTube. October has been observed as a month for breast cancer awareness for a very long time. It's just not in India, but it's globally observed as a breast cancer awareness month. We're all familiar with the pink ribbon and so on and so forth. But the moment we hear the word cancer, what happens to us? The fear that we feel, the despair that we feel, it's just not us, it's our families, it's our friends, just everybody around that. So in this environment, what is the role that a nurse plays, and just how critical is it? And for her, it is not even someone who's near and dear to her, but yet there is a significant emotional impact that she may feel. So, how are we going to look at that? This conversation is extremely important, and we have with us Lieutenant Colonel Dola Banerjee, who's currently stationed at AFMC College of Nursing in Pune, and she has a substantial number of years in working as an oncology nurse. So we're going to be asking her some questions about what is the role that a nurse plays in the in the entire care continuum of the patient. Not just that, is there a role that a nurse can play in preventive measures? Is there a role that she can play to support the family and friends? So step by step, we'll look at all these aspects, and we'll also learn from her how does she distance herself from what is going on, around her. So welcome, Lieutenant Colonel Banerjee. Thank you so much for giving us your time to have this important conversation. So my first question to you really would be, what is the role that technically an oncology nurse plays, and just how important is it?
Good afternoon, ma'am. Good afternoon to everyone. I would first like to bring the greetings of my institutions to you, that is College of Nursing AFMC, Pune. And thanks Japaigo and my mentor and my teacher, Brigadier Punita, who has given this the opportunity to speak on such a big platform. So the first question which you have asked me, is the role of a nurse, oncology nurse, in such a crisis scenario. Madam, the role starts from the beginning. The patient is diagnosed as a cancer, and before the patient is diagnosed as a cancer. It's not a specific role. We have to do one and finish it. The role doesn't end there. The role is varied. It starts from screening, from primary prevention to the tertiary prevention. So when you start with primary prevention, it's lifestyle modification, the health education, which we go on giving in various forms, like a health educator in communities, in hospitals, in OPDs. Then when the patient has already got the disease, then we go for secondary prevention. Then we make various screening tests which we do for the patients, which depends on various types of cancers. And then once the patient succumbs to the disease, then how we prevent taking care of the patient in the hospital setup, and how we help to carry over the bereavement. As we know, cancer is such a chronic disease which eats up not only the body but the mind also. The emotional setup of the patient is also destroyed. So in three-tier system, we take care of the patient on a whole and a holistic care, what we say in nursing.
I'm just going to take up on that holistic bit and ask you a quick question on, let's start from a preventive phase. So where do you see a nurse's role in, in disseminating messages about prevention, about screening, etc.? Is there a role that a nurse can play in that?
Yeah, ma'am. The role, as I so told, it is varied. It starts from primary prevention onwards. So what you're talking about is screening. The screening part is the secondary prevention. That means the disease is inside, but the person is not aware that the disease is inside. And just like we strain the tea, and the tea leaves are left in the strainer, and the tea is in the cup. So when screening, what we do, we take the patients who are actually having the cancer, and they are the tea leaves which are in the strainer. So now once we have the patients, when we have the bulk of the patients under screening, when we do in the population, and we get, there are various tests which depends on the type of cancer. So like as we have Ritu, we have discussed that this month is a cancer awareness week for breast. So I'd add to it, it is not only breast, it is also liver cancer, which we give the awareness of. But as we are dedicating it to the females morely, so breast, as you say, breast cancer screening test is first very important is self breast examination. Now, self breast examination is a very common thing which is almost done by everyone, every literate person who has a familial history of breast cancer, or might be having a suspicion of a breast cancer, or the literate group. But we try to spread this knowledge to the rural population also through our community health nurses and the ASHA workers who goes and spread this knowledge of breast self-examinations. And this breast self-examination, there are techniques how it has to be done, and how we can get to know whether we are having a breast cancer or any other symptoms of breast cancer. Apart from the breast cancer self breast examination, there are various other tests also we do, that is lab test. And for cervical cancer, the most important test is HPV test and the pap smear test. These are the two tests we do to detect cervical cancer, which are the two important cancers affecting the patients. In a population of 100, 24% of the population, female population, suffer from breast cancer, or 15% are succumb to death, which we can provide if we do the screening at an earlier stage.
Thank you, ma'am, for telling us about the role that the nurses can play in screening, in prevention. Do you also do some sort of awareness campaigns, disseminating information in the community where nurses play a critical role?
Yes, as a part of our community health nursing program and the NSS, that is a national service scheme, we ask students to go to villages and the communities, both the urban and the rural, to spread the knowledge of breast cancer awareness, not only in hospital setup, but also in the community, the rural population, the urban setup, and in OPDs, in the hospital setup, with the OPDs. Whenever there is a OPD, there is health education program which goes on both video and online and offline, which helps the patient to get aware of the most lethal cancer in India, that is breast cancer.
Okay. Ma'am, my next question would be, we moved from prevention and we just say that there is a patient who comes to you and they've just discovered that they have breast cancer. What is the role that the nurse plays from the moment that she comes in contact with such a patient, to various stages?
Now, once we come to the patient, like now we are talking of a hospital setup, that the patient is already having the cancer and we are receiving the patient in the ward. Now, as you know, as dreadful is the term cancer, the same way the patient is also affected in the same mentally, emotionally. Not only he, the family in which he belongs to is also affected. So the caregivers and the patient has to be dealt very carefully and very diligently. Now, dealing with the patient in the similar way requires lots of maturity, compassion, empathy, and critical thinking. If you don't have all this type of qualities as a nurse, then it becomes very difficult to tackle such crisis in situations. Because if the patient is very ill and sad, and if you also become sad and ill on the same time, then it becomes very difficult to cope with such crisis. So at such stages, a nurse has to be empathetic, compassionate, to be able to help him in his care and also to involve the family in the care. See, family in such some stages try to suffer from burnout syndrome. They stop caring for such patient because it is sometimes chronic and takes a toll not only on the health but on the finances also. So being in government hospital, we don't understand, but in a private setup, it takes a toll on the finances also. So to deal with those finances, the family has to really try hard and keep patience. So as a counselor, now her role becomes as a counselor, caregiver, and diligently she has to deal with the family members and involve the family members in the care. A therapeutic relationship, which we are taught in as a first year student, has to be maintained with the patient. If the therapeutic relationship is maintained, the nurse does not suffer from a burnout syndrome herself, or else she suffers from a stress and strain and anxiety, and she can have a breakdown.
Uh, that brings me to a very important question that has been coming up in the students have been posting. Um, how does the nurse actually take care of herself through all of this period? When she sees the patient's family giving up on the patient or the patient suffering, so she continues to support them. But what about her own mental health? What is it that you do to kind of distance yourself from this all, yet continue to give care continuously?
Yes, ma'am. Nurse is also a human being. She also has a heart and a soul. So seeing someone in pain also hurts her equally. But at that juncture, if she also falls down, then it will hurt her terribly. So sometimes it happens. It is not 100% always that she acts as a soldier and she can able to cope up with everything. Sometimes she also suffers from such issues like burnout syndrome, which I was talking about, stress and anxiety, and lands up into various complications like hypertension, diabetes. There are various other diseases which she succumbs to. But at this stage also, I will tell that a nurse can her keep her cool only through a very newer term which has come now is mindfulness. Mindfulness is nothing but a sort of meditation, you can say, where you think of what are you aware of. Just drive up of all your negative thoughts and think positive. And at present, what are you about to do? All negative things and all positive things. If you all negative things will go away, and the positive side of it will. But it is really difficult. It is not that easy as we say it. Mindfulness is not that easy. But when we are in a hospital setup to see the deaths and see the patients crying, it's really difficult to cope up with the things, and it happens with experience. And it is not easy for a newly mature nurse entering the onco field and getting used to and we will able to conquer it. It's not like that. It with experience we learn it and we are able to cope up with this form of stress and strain.
Right. Ma'am, you said it's not easy for a young nurse, and we have a lot of nursing students who are watching you. So, any practical tips that you can give as to how do they do it? Can they take out time for themselves within the busy schedule, or just sit down and kind of just breathe for 10 minutes? I don't know what are the techniques of mindfulness that you employ, but if you could just share some of those practical experiences or tips, that would be really
Okay.
helpful.
Yes, ma'am. The tips for keeping yourself cool is mindfulness. That is the stay of the hour. that is to meditate. And there are three types of meditation I will talk about. One is while sitting on walking, or while just lying down on your bed. You just sit and just close your eyes and count your breath. Just see how you breathe. Normally, it is a breathing is a involuntary action. You just don't know where you're breathing, how many times you're breathing, unless you start to count it. So you just close your eyes and sit and just watch your breathing just for 1 minute, and just forget everything which is happening around you and in the surroundings. This you can do while walking also. Just walk around your society. Just now you can't close your eyes. You have to open your eyes walking and count. You see your breathe as you breathing out and breathing in. Just forget about everything. This is one way you can do it. Another way is to be empathetic, not sympathetic to your patient. You be in the patient's place and understand his problems, but don't go so deep that you get involved with his problems. Involve the family and the relatives. This is the important crux of the communication which you have with your patient. Don't get involved with the patient's family, the patient. Involve the patient's relatives, patient's family members in the care, so that the burden of the care which you feel you should carry, the patient should and family should carry, and make the patient feel that that is not the end of the road. There are many things which are coming forward to which he has to conquer with the same disease.
I think that's a very sound piece of advice, ma'am. Which brings me to the next aspect of this entire caregiving, caretaking role that a nurse has to play. Do we have any sort of meetings where you discuss the moral and the ethics issue that may surround all of this? And also, do you have consultative meetings where you can discuss your emotions openly? So do you have any such kind of a mechanism?
In all nursing institutions, we have counselors and counselors for the students where they can open up and express their problems. It is not only hospital related, everything they can express, but it also depends on the student and the counselor what a relationship they have. So if someone will not open up to anyone so fast, you have to develop a relationship between. The first step is to develop a relationship between the one and other. Then only you can open up. Now, that sort of a relationship, they are taught in the class, and they are in practically also it is demonstrated to the students of nursing in our college. So, and the counselors are there who are equipped with knowledge, that are psychologists who take classes for them to tide over this type of a crisis in their life. So, it is not only with the patient. There are various types of other crises with the student faces, like in the exam, various type of small things which they think it is a big problem of the life, though it is not a big issue at all, but for them it becomes a big. So such type of we have guidance and counseling sessions for the students, and not only for the students, of the teachers also we have where the teacher can also open up and discuss the problems, and the problems are sorted out at its root level, then clearing up in a big way.
It's good to know that you have counseling sessions for the students and the nurses. The other question that has been coming up from the viewers is, are there any specific trainings that are required for a nurse to become an onco nurse? And if so, at what level can you specialize?
Now, there are after getting any degree like a BSc nursing degree, you can apply for a oncology nursing course. The first is a PB diploma course, which is a certified course by INC, the Indian Nursing Council, which is a 2 year. It is a 1 year to 11 months, 2 years course, with the nurse does to get itself equipped with the oncology setup. And then we have the postgraduate nursing in oncology, which is done in various colleges of the country. And Tata Memorial Hospital has also started PhD in oncology nursing. So we have you can specialize further in PhD also. So there are very certified courses of 6 months, like in specific things like palliative care, the holistic care. So specific thing, chemotherapy. So they are not for years, 2 years, 1 year. It is 6 months, 3 months. You can specialize in a particular area like palliative, holistic, nutrition in nursing, nutrition in cancer patients. So small courses are also given by small institutes in which you can get used to such courses.
I'm going to take up these three courses that you just mentioned, the palliative, the chemotherapy, and the nutrition. So if you could just tell us what is the role that a nurse can play, let's say during the chemotherapy or in the palliative care, or even when you are talking about nutrition and so on and so forth. So if we can take one at a time and you could just expand on it, that would really be helpful.
Yes, ma'am. Nutrition in cancer patients are very important because, as you know, when the patient is getting chemotherapy, his normal cells are also getting killed along with the cancer cells. So, nutrition plays a vital role in building up the body. Now, when I talk about nutrition, I'm talking about the protein building part because the cells we know are built of proteins. So, if we are giving a high rich protein diet to the patient, but as this stage also we should know that the patient are anorexic, patient are having vomiting after the effects of chemo. So the food which is given to the patient has to be palatable and nutritious too. So we have to take into mind two things, that the palatable and the nutrition part of it. So the patient gets the maximum nourishment and can come out of the chemotherapy. If the patient comes out of the chemo, then we know that the patient can go a long way. Now, how will we know as the patient has come out? Only the lab tests will tell us, and the lab test in which I should remind all the students who are hearing me, albumin, when we take albumin level, not serum protein, serum albumin tells us the recovery of the patient. If the patient is recovering, his albumin will rise, and we will know that the patient is really recovering well. The nutrition part, as I told you, and more thing we have to take into mind is the microorganisms, which are play a very important role when the chemotherapy, the immune system is down. So the diet of the cancer patient has to be infectious free, microorganisms free. So all the food which are given to the patient, cancer patient, has to be microwaved or autoclaved. We pass it through a microwave and or high through with boiled food or through pressurized cooking. The food are cooked so that the microorganisms in all respects are killed. This was the nutrition part of it, ma'am.
So, ma'am, you're talking about the nutrition part of it. It also brings me to this whole question about the team player. How is a nurse's role? When she's managing, she's the one who's really the closest to the patient at all times. So, how does she manage? The various aspects of care that is being, whether it is a nutritionist, whether it is radiologist, whether it is doctors, whether it is, various players. So, how does she manage all of that, and what are the skills that you require and capabilities that you require?
Ma'am, when we talk of nursing, is always a multi-sectorial approach, and when we deal with caring of a cancer patient, various people come in, the stakeholders who work in the care of the patients, like as you have mentioned, the radiotherapy, the pharmacists, the psychotherapists, the physiotherapists, the various people who come into play in the care of the patient. Now, how does a nurse manage? Now, how does a mother manage everything in the house? So, in a similar way, we say that a female is endowed with a quality multitasking. Multitasking is the word which I should give to the nurse who handles everything, all the appointments, everything in and is able to take care of the patient by multitasking her things. And the team members of a nurse are also so many people are under her also who take care of meeting this needs of the patient and the effects of this care.
You said multitasking. So, so are you taught some sort of management, chapters as well, so that you can have this entire team playing leadership qualities? Could you talk a bit about the leadership qualities that you would require as a nurse?
Yes, ma'am, we have in the curriculum when we teach, when we go through the curriculum of us basic nursing, we have in the curriculum nursing administration and management, which forms 100 marks subject in the curriculum, which the students has to pass. And in nursing administration, we are taught administration, we are taught leadership qualities, the various types of leadership, from autocratic to laissez-faire. We're taught everything, and we taught the like trials, unity of command, unity of reference, spirit corps. We are taught everything in the field, but practically we face it when we once we reach in the hospital setup. So once we go to the hospital setup, everything is not flower in the rose. Everything is not. There are thorns also. So every time you don't, if you stand with a stick and try to rule, people don't listen to you. It is how you speak, how you communicate with the people, how you demand the things, respect them, respect your subordinates, demand the care. That is how you become a good administrator or a good leader in your ward setup. Now, ward is becomes our home. It's a home-like thing, and patient is like a guest to us. Now, as the patient is a guest, we treat him in the guest way, and all our team members are the members who help us getting the guest the best of the care we supposed to give to him.
Thank you, ma'am, for that. You said, you learn in theory and putting it in practice. So, how do you, for a young nurse who's just studied all this theoretical information and then she comes or he comes into a hospital setup, what are the three things that you will ask them to always remember when they're working in a cancer ward?
Ma'am, the three things which I will tell the student to learn is to not to be emotionally carried away by the communication of any of the team members. Think maturely and decide what should be the priority for you. When we reach the ward, priority for us is the patient. So everything regarding the patient is important to us. Rest comes later. So priority wise, you have to decide what work you have to do. That is first is the patient. Then you have to be emotionally stable. You can't be labile. Then you can't be a strict administrator. You have to be a good listener and a good communicator so that you can communicate to your team members. And role decider. You have to decide who has to give which role. You can't give a newly girl who is coming, newly passed out girl from a college, the role of a ward sister who will rule the ward. No, that is not done. The girl is not exposed to such an experience. So role role divided, which who has to perform which type of role you should know. So you have to be a good communicator, a good listener, a role divider, and a good communication skill is the key to the care of the patient of cancer.
That's lovely. So I'm hearing that mentoring is an important part as well. So what would you suggest for the nurses in service or even for our student nurses to remember, as what is it that the importance of mentoring? How important is it? How does it shape their career, their thinking? If you could just talk a little about that.
Yes, ma'am. Mentoring is forms an important part of a teaching curriculum, ma'am. Yeah, because we don't mentor the person to become just a nurse. We mentor the person to become a good human being. Now, a good human being a person can only become, then only she or she can become a good nurse. Because a good human being has quality of care, empathy, and a bit of listening power, communicative power. So, if you are a good human being, and that we can mentor only when you become a good human being, unless you practice before self, that means you have to practice. A teacher leads the group. If you don't practice yourself, a good mentor, then the students also don't listen to you. So whatever you are preaching, you have to practice this too, so that the student follows you. So mentoring is just not talking and going away. You have to practice what you're talking also. So once you practice this in the clinical setup, the student sees you, and then understands that setting examples, and he tries to imbibe the example which you have set in.
Sorry, ma'am, my internet was a little unstable for just a moment. I'm back, and I think uh, I think that's been a great conversation with you, and I really thank you on behalf of Mission Niramaya for coming and talking to our students and telling them about the role that a nurse can play as an oncology nurse. It extends not just to caregiving, but it extends even to taking care of the family, being the leader, and making sure that the patient receives a holistic care. So thank you so much for sparing your time and talking to our students and faculty. Thank you so much, ma'am.
Thank you, ma'am. Thank you.
Okay. Bye-bye.
Bye bye.